Hello, my name is Dr. Michael Dody, and I would like to talk to you today about the ketogenic diet. But before I do, let me tell you a little bit about myself. I'm a chiropractor practicing in Littleton, Colorado for the last 15 years. I started to do research on a diet to help my performance and to increase longevity. That is when I stumbled onto the ketogenic diet. I started to follow the guidelines we are going to talk about today, and not only did I notice increased energy and brain function, I also lost 40 pounds without exercise or willpower. In fact, I've kept those 40 pounds off for over a year. I bet you're wondering how I did this. Well, let's jump in and find out more about the ketogenic diet. A ketogenic diet is a very low carbohydrate diet which turns the body into a fat-burning machine. It has many potential benefits for weight loss, health and performance, but also has some potential initial side effects. A ketogenic diet is similar to other strict low-carbohydrate diets like the Atkins diet or low-carb, high-fat. These diets often end up being ketogenic more or less by accident. The main difference between a strict low-carb, high-fat and ketogenic is that protein is restricted in the latter. A ketogenic diet is designed specifically to result in ketosis. It's possible to measure and adapt to reach optimal ketone levels for health, weight loss, or physical and mental performance. I'm going to talk about how you can learn to use a ketogenic diet to achieve your personal goals. What is ketosis? The keto in a ketogenic diet comes from the fact that it makes the body produce small fuel molecules called ketones. This is an alternative fuel for the body used when blood sugar or glucose is in short supply. Ketones are produced if you eat very few carbs that are quickly broken down into blood sugar and only moderate amounts of protein. Excess protein can also be converted into blood sugar. Ketones are produced in the liver from fat. They are then used as fuel throughout the body, including the brain. The brain is a hungry organ that consumes lots of energy every day, and it can't run directly on fat. It can only run on glucose or ketones. On a ketogenic diet, your entire body switches its fuel supply to run almost entirely on fat. Insulin levels become very low and fat burning increases dramatically. It becomes easy to access your fat stores to burn them off. This is obviously great if you're trying to lose weight, but there are also other less obvious benefits, like for example, less hunger and a steady supply of energy. When the body produces ketones, it's said to be in ketosis. The fastest way to get there is by fasting, not eating anything. But obviously, it's not possible to fast forever. A ketogenic diet, on the other hand, can be eaten indefinitely and also results in ketosis. It has many of the benefits of fasting, including weight loss, without having to fast. What are the benefits of a ketogenic diet? The benefits that come from a ketogenic diet are similar to those of any strict low-carb diet. However, the effect might be even greater since protein is more restricted. This raises ketones more and lowers insulin, the fat-storing hormone, more. Let's look at a couple of the benefits of a ketogenic diet. Weight loss. Turning your body into a fat-burning machine has obvious benefits for weight loss. Fat burning is vastly increased while insulin, the fat-storing hormone, levels drop greatly. This creates ideal circumstances in which fat loss can occur without hunger. Around 20 randomized controlled scientific studies show that compared to other diets, low-carb and ketogenic diets result in more effective weight loss. How does this work? Weight loss is often simply thought of as a question of calories. Eat less and burn more and you'll lose weight. This is true in theory, but not very practically useful, as evidenced by a massive obesity epidemic during the period when people believed this. The big problem with focusing on calories is that it ignores hunger. It ignores the body's regulation of its fat stores. It ignores the fact that we do not eat calories, we eat food. And food is so much more than just calories. Some food, usually low carb, makes you feel satisfied. Other things, like soda, just make you feel even more hungry. The basic idea of low carb is to work with your body instead of against it. Instead of wasting time and willpower by restricting calories, exercising, and enduring hunger, we do something else. We make the body want to eat less and burn more of any excess. This is done by altering the hormonal balance, and one hormone above all others is fundamental to doing this: the fat-storing hormone insulin. Lowering insulin increases fat burning, enabling the release of stored body fat. In the long run, this results in reduced hunger and even increased energy expenditure, even without exercise. Another benefit is reversing your type 2 diabetes. Yep, you heard me right, reversing type 2 diabetes. Low carb is very effective for reversing type 2 diabetes. This has been demonstrated in a number of modern high-quality studies. It is very unsurprising that low-carb diets work well for reversing type 2 diabetes. The main problem in diabetes is too high blood sugar levels, and the sugar in the blood comes from the carbohydrates that we eat. So, if you eat fewer carbohydrates, it's very logical that it becomes easier for the body to control its blood sugar levels. Improve mental focus. Ketosis results in a steady flow of fuel, ketones, to the brain. And on a ketogenic diet, you avoid big swings in blood sugar. This often results in the experience of increased focus and improved concentration. A lot of people specifically use keto diets for increased mental performance. Interestingly, there's a common misperception that eating lots of carbs is needed for proper brain function, but this is only true when ketones are not available. After a few days or up to a week of keto adaptation, during which many people experience some difficulties concentrating, have headaches, and become easily irritated, the body and the brain can run effortlessly on ketones. In this state, many people experience more energy and improved mental focus. Improve physical performance. The ketogenic diet can vastly increase your physical performance by giving you constant access to all the energy of your stored fat. The body's supply of stored carbohydrates, glycogen, only lasts for a couple of hours or possibly less of intense exercise. But the fat stores can carry enough energy to easily last for weeks or even months. The problem is, when your body is used to burning primarily carbohydrates, as is the case with most people today, your fat stores are not easily available and they can't fuel your brain. This results in you constantly having to fill up by eating before, during, and after long exercise sessions, or even just to fuel your daily activities and avoid hunger. On a ketogenic diet, this problem is solved, as the body and the brain can easily be fueled 24/7 by your powerful fat stores. You can keep going forever, like the Energizer Bunny. Whether you are going for a physical endurance feat or just staying focused on reaching some other goal, your body has the fuel it needs to keep you going and going. So why do most people believe that carbs are necessary to perform exercise? There are two reasons. To unlock the power of ketogenic diets for physical endurance and not instead suffer reduced performance, you need, number one, enough fluid and salt. When starting low carb, it is very important to drink a large glass of water with a half teaspoon of salt 30 to 60 minutes before exercising. This can make a huge difference in performance. Number two, 2 weeks of adaptation to burning fat. It does not happen instantly. The second cause of reduced early performance is not as quickly fixed. It simply takes time for the body to transition from being a sugar burner to primarily burning fat for energy, even in the muscles. This may take weeks or even a few months. The more you exercise while on a low-carb, high-fat diet, the quicker you will see this happen. The end result has many benefits. While transitioning to a low-carb, high-fat diet often reduces early physical performance, there are many long-term benefits. This is something that has only recently begun to be appreciated. In fact, a lot of elite athletes are now experimenting with low-carb, high-fat diets, and in some cases, they are crushing the competition. The benefits of low-carb, high-fat diets in sports are mainly seen in long-distance running and other endurance events. The body's fat stores are huge and dwarf the minuscule glycogen stores. This means that once an athlete has transitioned to burning fat instead of carbohydrates, he or she will be able to perform for long periods of time without needing much, if any, additional food for energy. This frees the athlete from having to activate his or her gastrointestinal organs during activity. Instead, a large amount of the blood flow can be directed to the muscles. This also minimizes the risk of stomach problems during the activity. Another benefit comes from the reduction of body fat that usually occurs on low carb. This reduction in body fat percentage and lightening of the body is a huge bonus for most sports. What do you eat on a ketogenic diet? Typical foods to enjoy on a ketogenic diet are healthy fats, meat, fish and seafood, eggs, cheese, and vegetables that grow above ground. The most important thing to reach ketosis is to avoid eating most carbohydrates. You'll probably need to keep your carb intake to under 50 grams per day of net carbs, ideally below 20 grams. The fewer carbs, the more effective. This means that you'll need to completely avoid sweet, sugary foods, plus starchy foods like bread, pasta, rice, and potatoes. Basically, follow the guidelines for a strict low-carb diet, and remember, it's supposed to be high in fat, not high in protein. A rough guideline is below 10% energy from carbohydrates, the fewer carbs, the more effective. 15 to 20% protein, the lower end is more effective, and 70% or more from fat. How to reach optimal ketosis. Getting into ketosis is not a black or white thing. It is not like you're either in ketosis or out of ketosis. Instead, you can be in different degrees of ketosis, as this chart demonstrates. The numbers below refer to values when testing blood ketone levels. Below 0.5 millimolar is not considered ketosis, although a value of, say, 0.2 demonstrates that you are getting close. At this level, you're still far away from being maximum fat burning. Between 0.5 and 1.5 millimolar is light nutritional ketosis. You'll be getting a good effect on your weight, but perhaps not optimal. Around 1.5 to 3 millimolar is called optimal ketosis, and it is recommended for maximum mental and physical performance gains. It also maximizes fat burning, which can increase weight loss. Values of over 3 millimolar aren't necessary. That is, they will achieve neither better nor worse results than being at the 1.5 to 3 level. Higher values can also sometimes mean that you're not getting enough food, also known as starvation ketosis. For type 1 diabetics, it can be caused by a severe lack of insulin that requires urgent attention. Values over 8 to 10 millimolar are usually impossible to get just by eating a ketogenic diet. It means that something is wrong. The most common cause by far is type 1 diabetes with severe lack of insulin. Symptoms include feeling very sick with nausea, vomiting, abdominal pain, and confusion. The end result can be a state called ketoacidosis. That may be fatal. Needless to say, abnormally high ketones requires immediate medical care. How to achieve ketosis. There are many things that increase your level of ketosis. Here they are from the most to the least important. Number 1, restrict carbohydrates to 20 digestible grams per day or less. A strict low-carb diet. Fiber does not have to be restricted. It might even be beneficial. Number 2, restrict protein to moderate levels. If possible, stay at or below 1 gram of protein per day per kilogram of body weight. So, about 70 grams of protein per day if you were to weigh 70 kilos or 154 pounds. It might be beneficial to lower protein intake even more, especially when overweight, and then aim for 1 gram of protein per kilogram of desired weight. The most common mistake that stops people from reaching optimal ketosis is too much protein. Number 3, eat enough fat to feel satisfied. This is the big difference between a ketogenic diet and starvation. That also results in ketosis. A ketogenic diet is sustainable. Starvation is not. Number 4, avoid snacking when not hungry. Unnecessary snacking slows weight loss and reduces ketosis. Number 5, if necessary, add intermittent fasting, like a 16 to 8 ratio. This is very effective at boosting ketone levels as well as accelerating weight loss and type 2 diabetes reversal. Potential side effects of ketosis. Can ketones get too high, even dangerously high? Not under normal circumstances. For most people, it's quite a challenge to even get into optimal ketosis. Getting into dangerously high ketone levels, more than 8 to 10 millimolar, is almost simply impossible. The main exception is for type 1 diabetics, where the pancreas does not produce enough insulin or is not producing any insulin. In type 1, it's very possible to get dangerously high ketone levels just by forgetting to take your insulin injection. There are other situations like breastfeeding or taking type 2 diabetic medications called SGLT2 inhibitors that in rare situations can cause too high ketone levels. This will result in feeling sick, nauseous, and very weak, and it can develop into a life-threatening condition called ketoacidosis. There's a simple treatment if you suspect this may be happening. Eat some carbohydrates right away. For example, a couple pieces of fruit or a sandwich or a glass of juice. If you are a type 1 diabetic, take more insulin. Then contact emergency medical services if you do not immediately feel better. There's one last thing I want to talk about, and that's the keto flu. While ketosis is normally safe, it is common to experience some limited time side effects. People transitioning from sugar burning to fat burning mode often initially experience side effects. This is referred to as the keto flu, since symptoms are similar to those of the flu: fatigue, nausea, headaches, cramps. There are two main things that one can do to prevent or alleviate these symptoms. Number 1, drink water with salt and lemon. Alternatively, have a daily cup of bouillon. Number 2, gradually reduce carbohydrate intake. Stopping suddenly results in more temporary symptoms. When starting on a ketogenic diet, you lose water and consequently electrolytes. This is happening since carbs retain water and salts in the body, so when you stop eating carbs, your body loses this water. If the keto flu is happening due to too little hydration, it might help to drink a glass of salt water with a little bit of squeezed lemon in it. When carbohydrates are suddenly removed from the diet, the brain can run slightly low on energy before it learns to use ketone bodies for fuel instead of sugar. This means that if you get drastically reduced carbs from one day to another, you may get symptoms such as tiredness, nausea, and headaches. Replacing fluids and electrolytes as described above can alleviate the symptoms, or by instead gradually lowering carb intake over a period of a week or more, the body gets used to burning fat and ketones instead of glucose, and there will be usually no symptoms. If you do not wish to gradually reduce carbs, make sure to get enough fluid and salt to minimize the symptoms. After a week or so, the body is usually adapted to the ketogenic diet. While this in no means is a comprehensive look at the ketogenic diet, I hope it helps you better understand what ketosis is. If a ketogenic diet sounds interesting to you and you would like to find out more about specifics for your individual situation, please contact me at my office in Littleton, Colorado. The number is 303-794-1737. In fact, if you contact my office and reference this video, I will do a free 30-minute consultation with you to see if the ketogenic diet would work for you. Thank you for your time and consideration.